The pandemic is having a major negative impact on the mental health of kids and teens across the country. That is according to the CDC. Mental health professionals and school counselors say that's true here in Indiana as well. Our Alyssa Donovan explains what is being done to help students and how you can recognize warning signs in your kids.
As students continue to adjust to hybrid or virtual learning, lack of social interaction with friends and lack of extracurricular opportunities is starting to have an impact. Counselors within schools and mental health professionals in hospitals are seeing an increase in kids who need help.
This is how the mind appears when it's calm, bright, serene and happy.
This is a video students at Clay Middle School watched last week during their study hall period. It talks about mindfulness and how stress can impact students, giving them tools to use when they're feeling overwhelmed or a sense of anxiety. Something Brittany Coates says they're seeing quite a bit of this year.
We are definitely seeing an increase of students talking about anxiety when it comes to either their own personal relationship or experience with COVID.
Coates is one of 45 counselors and social workers within Carmel Clay School District. She says in her 8 years working with students, this has definitely been her busiest year.
Definitely an increase in the frequency that we're meeting with them.
And it's not just in our schools. IU Health has also seen an increase in those under the age of 18 coming in for mental health issues.
Any place from 11 to 15 or 16 is where I've seen most of the increase.
Dr. Ann Gilbert says most are coming in with depression and stress. In the past, she would have seen maybe 5 or 6 kids a day, but that number has doubled.
We're hospitalizing more of them too.
Gilbert believes the lack of socialization is a big part of the problem.
One of the most important things that kids do in their life at this point in time is form relationships.
And social workers like Coates are trying to help address these issues with students as much as possible. Coates is meeting with students daily, in person, over Zoom, and through a messaging system in their online class portal.
So we are definitely seeing that there are students who wouldn't typically reach out, but they are reaching out now.
While her school district is working to normalize conversations around mental health with videos like this, she's also encouraging parents to talk with their students at home. I'm Alyssa Donovan, WRTV.
There are some warning signs that a child or teen is struggling with depression or anxiety. This includes losing interest in activities they used to be interested in, no longer talking to friends, and changes in eating or sleeping patterns. If you notice any of these, reach out to your school counselor or a mental health professional.